So really quickly, I'd like to introduce you to I almost said doctor, to George Vradenburg. Everyone's been a doctor. Who, as many of you know, is the founding chairman of the Davos Alzheimer's Collaborative. And as many of you also know, Davos Alzheimer's Collaborative was really at the epicenter for where we are right now, starting back in January at the World Economic Forum in partnership with McKinsey, in partnership with a number of other organizations. I think the critical mass started to build and has taken us to Houston. It's taken us now to Calgary. It's hopefully going to take us through to the UN General Assembly, G20, and back to WEF, and then hopefully, as Dr. Gross mentioned, back to G7 in France, where this will hopefully culminate in an effort that we have where the mental health, brain health, and brain capital and the brain economy are indoctrinated as part of the G7 agenda. One quick thing I just want to mention is we have, if you go back to what Jenny mentioned and what many of you participated in, a lot of the roundtables, we took a lot of the feedback that you had during those roundtables and we built it into a declaration that's been used and presented as part of this G7. That declaration is available on the website. We're going to put a QR code up here. So if you guys want to just take a quick snapshot of that, that's going to take you to the document. We'd like to ask you to spread it around. Share it with your networks. Make sure that everyone who is in a position of decision making and hopefully policy sees it, and we can start to perpetuate it from there. Welcome, George.
So I'm going to start very briefly here to talk about how much insight has been generated today. It's quite an extraordinary array of speakers and range of speakers who've spoken today about this extraordinarily important topic. So I am a JD, Doctor of Jurisprudence, not a doctor, but I've lost 3 generations of my family to some form of dementia. Of course, a grandmother for whom it was called some other disease, a mother that was lost to what was called Alzheimer's, but in fact was Lewy bodies, and a brother who was lost to dementia recently. So this is very much a family affair. It's very much to protect my children and my grandchildren. And if we don't make more progress in the next 10, 20 years, than we've made in the last 40 years, we're not going anywhere. So I am very much identified with Linda and her story because there's enormous frustration in the patient community about all the great scientists who talk about their science, but we never see the fruits of that. And so as a patient thinks about this problem, they love basic science, they want it funded, they want every scientist in the world to get a Nobel Prize for doing something about the brain disorders that our families are experiencing. We want every business executive to get major awards and have their companies be very profitable about producing medicines and therapies and other things. And we want health systems to actually deliver this to us. Because right now we've got 2 disease-modifying drugs in the Alzheimer's space, but the health system has no clue on how to detect and diagnose and actually prescribe these medicines in a safe and thorough way. So enormous frustration that every scientist out there will say we're making great progress, and every patient out there says, I haven't got much choice. So this is a passion project, and patients have the unique ability to say, we want you all to work together. Hey, government, we want you to invest in research. Hey, companies, we want you to innovate and bring products to market. Hey, regulators, we want you to be receptive to safe and effective therapies because we need them. And payers, we want you to reimburse for these products. And health systems, we want you to deliver. But every one of those stages has to work together in their respective domains in order to get to us what we need as patients. And it's not working. We're going to hear a lot about the G7 and the declaration that we did on the brain economy. The likelihood of the G7 actually putting into their communique at the end of Tuesday or Wednesday, something about the brain economy, I would say, is near zero. Why? They're focused on tariffs. They're focused on whether or not we're going to take over Canada. We're focused on a lot of AI things and climate change things, but this has not risen to the level of a priority for national governments, at least at the global level. In the United States, we've been successful in getting basic research investment from our government up to $4 billion a year. Good, if we can hold it. It's not clear, given what Trump is doing to our biomedical research system in the United States, that we'll be able to hold that funding. But we're going to, as patients, with the cancer community, with the diabetes community, with the heart community, and with rare disease community, we have a patient advocacy effort across all that to try and preserve that funding. But nowhere else in the world, maybe with the exception of China, is that kind of money being spent. Europe is finally beginning to think maybe 200 or 300 million a year. We're talking 4 billion in the United States, 300 million a year. UK, 75 million pounds a year. Whoopee. But these governments are not investing anywhere near what they have to invest in innovations in the brain space in order to make progress. And that's just investment in the science. Are regulatory systems and payer systems tuned to be more receptive to innovations in the space? And the answer is a struggle. It took us almost a year to get the EMA and Europe to approve a disease-modifying drug for Alzheimer's. And that's not the exception. You look across all the brain disorder space, and the system simply is not working for us. So we're frustrated and we're unhappy. So what do? We can't go away. These diseases are still affecting us. So we can't walk away from this. So we have to, as patients, be persistent, we have to be imaginative, and we must be forever committed to finding more ways to push the system in our direction rather than the direction that it would normally go. So Linda speaks for all of us across a wide variety of brain conditions, and now we know that the brain is plastic all of our life. So many of these conditions can be mitigated, maybe prevented, with a lot of brain resilience stuff. And the scientists are finally thinking, gee, maybe that's true. Let's look at the science of brain resilience. But we're just starting that. Where have all of us been? Where have all of those scientists been? So I am expressing and starting with a little frustration, but it is genuine and it's honest, and I think it reflects probably what Linda has told us she feels as well. So what are we doing? So the Davos Alzheimer's Collaborative is a global health mechanism on the familial line of Gavi and CEPI. It was formed by a partnership of a pharma industry, which I am part of, and the World Economic Forum, to do for brain disorders what we've been able to do for infectious disease. So this is a lifelong passion now for mine. We actually have programs of global cohorts around the world that actually collect data on the brain and a common data protocol with an open science platform. We have global clinical trial structures that we're forming, and we also have now work in over 70 health systems around the world. But we're missioned to connect what's going on in the global north with the global south. Because the global south, folks, is where most of these diseases are. Mental health, neurological health. It's not in Canada. I mean, Canada, of course it's important to you. But 80% of the cases of dementia are going to be in the global south by mid-century. And so we have to figure out how it is that we're going to deal with this around the world. And so that's what the Davos Alzheimer's Collaborative was set to do. So at Davos this year, 2025, we created something called the Brain House. We said, why are we in our respective silos, our disease silos, which are important for some scientists because they regard this problem as a mechanistic issue around particular therapeutic areas. And mental health people were there, neurological people there, investors were there from Silicon Valley, from Goldman Sachs, health systems were there, the WHO was there. So there was a wide variety of voices saying we ought to be thinking about this in a much more broad and holistic way, and then talking about it in terms of its economic impact and fiscal impact on countries, because we may be able to get more attention from global governments, or at least national governments, through that argument than through the argument of health. If you put this onto the G7 health ministers, which we've done now for 10 years, believe it or not, 10 years we've had this in the G7 health ministers communique, but no action has occurred. There's no working group of the G7 health ministers, and so in fact, we have not been able to be successful. So let's try the heads of state. And we asked the heads of state, the declaration is up here, but in it is also a request: make brain economy a central pillar of what you're doing, or a pillar, not central, a pillar of what you're doing. Second, we want you to direct the finance and health ministers to work together to produce an action plan for the G7 in France on what we will do as an national economic policy with respect to these diseases. And we want you to recognize the brain economy as a central pillar of national competitiveness and workforce productivity in an age when, in fact, fewer workers are going to have to support larger populations. So that was Davos in January. And then we started saying, okay, how do we move this forward during the course of this year? So Houston, Texas, we had an event last month in May, right? A 2-day event centered on the business community. And you heard from Crystal the articulation from the business community about this issue. Health is viewed as a regulated industry. Privacy constraints, all sorts of data constraints. So they don't use that word, at least Shell doesn't, and I think that Shell is not unique in that regard in terms of their resistance to brain health. Now you talk about brain capital. If in fact you can do a better job at all the risk reduction factors that Crystal laid out with respect to preventing late life neurological problems, you will get better business results. So out of Houston was this commitment to figure out how to measure this, how to associate the measures of better performance in the workplace to your competitive standing in your industry, to your stock price, to the financial returns to your stockholders. So Houston set the stage for a series of actions that in fact the business community is now trying to figure out how to take forward. I know time is a problem. Okay. I'm between you and your drinks. So that was Houston. But the other thing that came out of Houston, which was remarkable, and David is leading this now, is the notion that Houston publicly has claimed we want to be a leader in the brain economy hub. We want to be an innovation leader. We want to be a lighthouse, is what David said. That's a challenge. Alberta should be saying the same thing tomorrow. I challenge you all to say the same thing. We want to be a brain economy hub. Articulate it how you wish, but demonstrate that this community, with its extraordinary resources in science and in academic and scientific fields, and the business community, you've got oil up here too, so does Houston. I mean, they're talking about this as a business issue. Get Alberta to stand up. And you've heard the invitation from Houston. We'd like to relate. We have to figure out how to exchange this. This is a big enough opportunity. This is not competitive. Let's figure out how to work together. And we'll work on Paris next. We'll work on Silicon Valley, which is more tech-oriented, but technology is going to be a big piece of this to make sure that human intelligence is comparable to the AI. So this is, I challenge you, whether we're successful with the G7 or not, I challenge you to basically, as Albertans or Canadians, to basically step up and make the same claim that Houston did. Next, we'll move to the United Nations, where a number of agencies of the United Nations, whether it's UNITAR, the UN agency for training and lifelong training, or UNICEF and education, and the FAO, the Food and Agriculture Organization. We haven't heard from the nutrition and food industry, which is sort of an enemy of this, not enemy, essential part of being able to change our brain health through life, as is the built environment, as we learn more sensorily how it is that we can create environments in which we work, which are more brain friendly. The AI industry, which you've heard before, very well articulated by Alicia, about how we work with the AI industry to assure that in fact those AI machines have the same capacity that we have. We're going to be able to control them because they can't do what we can do. They cannot do what the human brain does. And they can't do it over the life course. You got the same brain when you're born as when you die. Same brain. And it has a lot of insults during life, and it has a lot of resilience factors like education and training and play and all that stuff, but it's the same brain through life. So how do we get the United Nations agencies engaged in the United Nations General Assembly? So we will do that. There's an allied organization, a partnering organization that wants to create a hub of hubs. So it's Houston, it's Alberta, it's a variety of hubs around the world that want to be the centers of this. How do we create a conversation among those hubs about how to organize and how to exchange what we do together so everybody rises? After that, we have an annual meeting of my organization in Lausanne, Switzerland, which will review all of this work and move it forward. And then we go to the G20 in November, which will be a focus on Africa and obviously the Global South, because we've now started in Africa a continent-wide brain health plan for Africa, where Africans, who are going to be 40% of the world's population by mid-century, or is it end of century, sometimes I've forgotten what that measure is, they are concerned about their kids and how to identify resilience factors and to build the workforce for the 21st century that all of us are going to need. So Africa will be the supplier of workers around the world. As our workforce shrinks and shrinks and shrinks, they're going to be the workforce suppliers. So we have an interest in making sure Africa succeeds. And we'll work with India. India wants to do an October meeting, which I think is a bit of a challenge, but in fact we'll work with India because India is on the path now in the same way to trying to figure out its problems. So, and then we'll go back to Davos in 2026. And by that time, we're hopeful that this whole series of partners and the whole regional efforts that we're trying to make forward and the multiple sectors that we can bring to this actually have an action plan. Who needs to do what in order to us to make this transformation, this imaginative leap of transformation? And then 2026 will be probably an elaboration of all of that, starting with the G7. So, I mean, this is going to take a little time, folks, but in fact, we have got to work with the kind of persistence, commitment, and dedication to changing this narrative into putting it into action so that in fact patients like us get a chance at actually having therapies. I just want to close with a couple of comments. Thanks to Hotchkiss and the University of Calgary. I mean, terrific event, terrific. Thank you very much for putting all this together. I want to particularly call out Jenny Young. Jenny from the Canadian Brain Research Strategies has laid the tracks and run us like trains over those tracks to get here through multiple convenings, through meetings. But Jenny, you have been the driver and the creator of this event, so I thank you so very much personally. And Jean Day has been our great friend from the Alzheimer's Society of Montreal, to get us where we are and dealing with the Canadian Sherpa in terms of a conversation that at least got us communicating with the G7 in an intelligent and thoughtful way, hopefully to get them to embrace this approach and to put something in the communique about the approach and potentially to direct the finance and health ministers to take this to the G7 in France. So it has taken a village, and there are many, many more people, hundreds of people that were involved in the prep for this convening, and lots of insights. But folks, this is a heavy lift. It's going to take us time, and it's going to take a lot of collaboration and a lot of creativity, but I'm going to call on you in Alberta to step up and declare yourself a real lighthouse adjacent to and partnering with Houston to move this forward at the regional level. This is where you collaborate. It's tough to collaborate with scientists and industry and health systems and regulators around the world at any particular point in time, all of which we will do. But in fact, this is where it happens. It happens on the ground in these regions where the concentration of assets is so great. Thank you for being here today, and I really appreciate what you're doing for us, for Linda and me, as we go forward. So thank you.
For the record, Crystal was wrong. I am the last person standing in your way between drinks. And I'm going to give a quick plug for something that I wouldn't normally call out, but I do want to make sure that you guys remember it. There's been a lot of conversation today about how do we get to breakthrough? How do we get people to care about this? Each one of you probably has a dedicated team, or at least somebody in your organization who is really good at communicating. And I would encourage you to seek them out, because communicators are the key to helping to translate all of the brilliance that you have to really the understanding that policymakers, business leaders, everyone else needs to have to be able to take this forward. Reach out to your communicators, reach out to folks like me who can help to translate all of this. George just stole my thunder on all the other folks I'd like to thank, so I'm not even going to repeat that, but Hotchkiss, Jenny, Harris, and a few others. Be sure to check out the Innovation Showcase if you haven't already. It is pretty cool, and drinks are through those doors. Thank you very much.